Hi there, Dr. Anand here. Welcome to my YouTube channel and our ongoing conversations about psychiatric disorders. We were talking about anxiety, and I think it would be important to devote one video to at least the roots of it. Of course, lots has been written about the causes of anxiety and trauma, specifically psychological ones. And I like these as a psychiatrist because I think they provide a nice balance to what the medications do. And they're important because unless you understand where they've come from, how will you understand what to do next in terms of treatment for the patient to provide relief, to improve functionality, and to help them rebuild their life? So I think it's important that we do go back, and this is obviously a huge part of our training. And writings go back to the time of Freud, even beyond that actually, in terms of how human beings function, what they need in order to develop. And oftentimes what we find with people with anxiety and trauma is that their sense of safety, their sense of the world being a safe place is just completely disrupted. They kind of live in an unsafe place. Can you imagine what that feels like? That the world is unsafe every day. We went through it partially with the coronavirus pandemic, whereby everyone you encountered you thought might have it and might pass it on to you, and what would happen if, and how would I deal with it if I became really ill, and all those kind of thoughts. Can you imagine living like that on a daily basis, right? And what it does to you in terms of the impact on your self-esteem, your confidence, your decision making, and you're obviously wanting to avoid feelings like that is understandable. And so you will make avoidant decisions. And we need to ask ourselves, why and how did this come about for particular patients? So we talk about trauma, and yes, we talk about the childhood, and yes, it's important to start there because that is when you're most vulnerable. I think most people will agree with that. As a child, you don't really understand the world. All you know of it is as it's presented to you, and then you're kind of haplessly navigating it, and we all know the ups and downs and navigating of growing up. But the point is that the world around you is pretty much determined by the adults around you. So can you imagine if you were exposed to something like domestic violence, yelling? For you, that's your world being rocked upside down. It doesn't make sense. It's jarring. It's a disruption. And you don't know what to do with it. And your stress hormones start to rage and you react with flight and fight. And it's very unpleasant to live through. Others have been exposed to sudden losses of caregivers, such as a parent, divorce, death, illness, that take them away from what they knew to be safe. A mother, a father, a brother, a sister, some feeling that there was a continuity is just broken, disjointed. And that can have a severe impact on what we call the ego development. The ego is arguably that part of ourselves which is the kind of psychological skin that navigates through the rest of the world. And again, I don't want to go into great detail about this, on a Freudian level. All I'm saying is that we need that outer coating, psychologically speaking, to be able to navigate the vicissitudes of everyday life. Well, you can imagine without that sense of nurturance, continuity, safety, structure, sameness, that you're not going to develop that level of skin integrity to be able to navigate what will inevitably be the slings and arrows of real life as you grow into the real world. And so you're vulnerable. You have a thin skin. And so it's interesting when I see patients in early adulthood, even later adulthood, with such a thin skin, so to speak, psychologically speaking, I know it comes from somewhere. It's come from some antecedent experience. And when you dig deep enough and you ask the questions, which patients don't tend to volunteer because they don't want to go there, because it's unpleasant. But if you ask tactfully, carefully, but in an inquisitive and caring way, you do actually begin to understand, oh my God, this is how the patient became this way. And you want to be able to remedy that which they went through, of course. If I could reach out to my patient and cure it like that, of course I would. But I can't. All I can do is provide what we call a corrective emotional experience. Provide that nurturance which is missing. Provide that continuity which is missing. Provide that caring which is missing. Provide that sameness and reliability that was missing. So that in itself acts as an antidote for the feelings that anxiety engender in them, which makes the world a horrible, scary, unpredictable place. If they know they can see me, if they know they can contact me, if they know that I'm there, that I've got their back, that goes a long way. And I believe in that symbolically. I really do. That our interventions help rewrite the script, so to speak. So that's the power of knowing the story of the patient's life, not just receptors and, checking off boxes about, were you sexually abused or physically abused. That's not good enough in my book. I want to know what it felt like for them growing up and the impact it had, in their words, for them. That's what therapists arguably do a much better job of than we psychiatrists do, because first of all, they spend a lot more time training in that area and being exposed to the various different theories that would explain the impact on somebody. But also, I think they're trained in the area of kind of empathic validation, more so than doctors, who you could argue are trained with the medical model, which is more of like, fix it, go in, change this, cut this out, try this med, which is not always really, the ideal approach for something so chronic, so deeply embedded. So we need to combine approaches. Of course there's relief with medication, I'll talk about that in a subsequent video. But I really think the approach to the patient with someone who's traumatized, and it doesn't have to go all the way back to childhood, it could go back to late adolescence, it could go back to even adulthood with an abusive relationship, domestic violence, sexual assault, rape, being suddenly ejected from your job by a very bullying employer or co-worker. These are all traumatic experiences, and I think we need to appreciate them for what they are and the impact that they have on someone in the way they begin to look at other figures in their life. And these are what we call transference reactions. They may react to you in a similar way as an authority figure because that button is already there. So these are really important aspects to uncover if we're going to properly treat trauma, which then leads to anxiety symptoms. If I were just to give you medications just to treat the symptoms, I'd really just be scratching the surface. And I don't think that's what most patients want either. It's a bit like trying to give Tylenol for someone who's got a headache because of a brain tumor. So you don't want to go that piecemeal route. And I've talked about that in my blogs, and I will talk about that subsequently. But we want to get to the root of the cause. We want to be able to partner with the patient, begin the journey with them, continue on the journey with them, and allow them to recover in a way that rewrites their own script so that they can re-own their life. So I hope this was helpful. This was a conversational kind of way of looking at it, but I hope that it was sufficiently educational that you will understand how doctors approach these kind of issues in a sensitive and meaningful way. So as always, stay safe, and I'll see you in the next video.